Okay, welcome to the last video on the Sinew Meridians. Pardon our renovation. We have a lot of new kitchen appliances and cabinets in the boxes behind me, so try and tune those out. So this is the last video that we'll be doing on the Sinew channels involving the treatment. So again, the objective of a Sinew Meridian treatment is basically to free trapped pathogenic qi and obstructed wei qi that's trapped in the Sinew channel level. Either from the Taiyang, if it's in its early stages and hasn't spread, or directly from whatever Sinew channel that has now been affected, since over time with some chronicity it has spread. So when the body experiences an injury, just as a brief review, right, the wei qi carried by the sinews that accumulates at the injury site, naturally creating some swelling, and that's really to immobilize the area, to prevent its use or overuse so it can begin to heal. And then as the wei qi accumulates, it starts to concentrate, which can result in a little bit of excess heat. But as with the swelling, this inflammatory response, if it's generally fairly mild, is a normal process in the healing, right? That's a normal response to injury in the healing process. So by concentrating wei qi in the area, not only is there more qi for healing, but the chance of transmission of the injury to adjacent sinews is reduced, right? So with less movement, with more rest, with more immobility, right? There's less chance that this pathogenic factor can be transmitted to other sinew treatments. So it's important in sinew treatments to assess the movement that is affected most, because the injury may occur at a certain area, but then, when you test the different movements, when you evaluate the different movements for the sinews, you may find that actually a different sinew meridian movement recreates more pain, and that's where you would treat first, and then moving back to the site of the original injury in that meridian. So it's also important to, make a note, as we've discussed in the diagnostic and assessment process, in that essay, is to look at the nature of the pain, the type of pain it is, right? So generally, if the pain is radiating, that indicates wind, right? That's the predominant factor. If the pain is stabbing, sharp, more spasms, more fixed, generally more fixed, that's cold, which is probably compounded by blood stasis, because cold can occlude the blood. If the pain feels kind of stuck in an area, not so pointedly fixed, but like the whole area, not like in one spot, but the whole area feels kind of like stuck and heavy, then damp is the predominant factor. And in this case, when there's cold and damp, you'll probably want to, I would highly encourage you to moxa some ashi points along the trajectory of that sinew channel that you palpate before treating, and then mark out to see for the patient, is it responsive? Is it like an usher, like, oh yeah, that's it, that's the sore spot? Or is it something that you feel, the patient may not feel much, but you feel that it's particularly hard or tight or hot or very cold, or on the deficient side, much more yielding, maybe even feels a lot better with pressure, like, oh yeah, that's a great spot, yeah, press into that, right? So you can mark those and then go back and moxa those as well. All right, so a couple of things when you're treating the sinews is to consider some of the potential underlying deficiencies that may compound the injury itself or inhibit the healing process. So one of these is the vitality or the strength of the kidney yang, right? So you want to check what in TCM they call the kidney yang pulse, which would be the proximal position on the right hand wrist. Is that strong? Does that feel vibrant? You also want to assess to some degree the stomach fluids. This can get a little bit complicated, but basically, if you press down on the earth pulse, right, the middle position on the right-hand side, when you get to sort of like what is considered to be a moderate level, does the pulse feel sufficiently full? Does it feel sufficiently resilient and strong? Not, forceful or pounding, not weak and overly yielding, but does it feel like, like al dente spaghetti, right? Does it feel like there's some resistance there? And then also, is the liver qi stagnant, right? So the liver qi needs to be coursing smoothly in order for wei qi to function as it should, as nature intended. So, is the liver gallbladder pulse tight, tense, wiry, right? Do they also have other signs and symptoms of a lot of qi stagnation, right? And then also get a sense of the lung qi, right? So that right hand distal position. Does the pulse feel sufficient? Does it feel like qi full, right? Or is it overly yielding, right? So you may need to make sure that there's enough lung qi by tonifying the lungs. Also, they talk about, are the lungs dispersing to the surface, right? So you can look up those signs and symptoms. I don't want to get too much into that, but obviously the first thing you look for is there any kind of what do they call it? Rebellious lung qi, right? Counterflow lung qi, where there's much coughing, right? Or some respiratory issues. All right, so after you've done that, then you're ready to treat. So the treatment involves basically a number of different points. The two primary points that you're going to be treating are the Jingwell point and what's called the gathering point. The gathering points are in your notes. So that's basically divided up into the three sections, right? There's the 3 yang arm, the 3 yin arm, the 3 yang leg, the 3 yin leg, right? So you're going to be using those points, and you're going to be using the Jingwell points. And I would say to really enhance the effectiveness of your treatments, you're going to be wanting to utilize and go back and treat Assure points, okay? So after you've, done all your questioning, you've done your movement evaluations, you've checked for the underlying deficiencies, then we're ready to start. There's a couple different strategies for treating the sinews. The easiest one is whatever sinew meridian seems to recreate the most pain. That's where I start. I do the gathering point first. I tonify it. I leave it in. I go back, and then I needle the Jingwell point. And there's a couple ways of treating the Jingwell point. One way is to just use maybe like a regular 1/2-inch needle. Sarans are nice. They're very thin and small. It's a Jingwell point, so there's not much depth to manipulate. And we're going to needle it distally, right? So it's always facing towards the extremities, right? Because we're clearing predominantly wind. So it might be a combination of wind cold, wind damp, wind heat, right? But most of these points are sort of relating to wind as the spearhead of disease coming in from the exterior, because the sinew is at the most exterior level. So traditionally, at least from what I learned from Jeffrey Yuen, that these needles are not retained for more than a few moments. So you would needle the gathering point, and then you would palpate the gathering point area, right? So if you're needling, if you're going to be treating like one of the 3 arm yang, right, then that's going to be gallbladder 13 area to stomach 8. So here's gallbladder 13, and then to stomach 8, right, in this area here. You palpate around whatever feels like especially tight, because the scalp, there's not a lot there, right? So whatever feels kind of like tight and tense, right, you can treat that, or Assure, or just treat the points. You could just treat, I just generally treat gallbladder 13, or you can treat like a couple of points in this area, leave them in, go back, and then needle the Jingwell point, right, which you just basically put the needle in. Let's say you're dealing with the large intestine channel, right, on the left-hand side. And so you would needle the gathering point, gallbladder 13 here, tonify it, leave it in for a moment, and then you would just basically be needling large intestine 1, like that, right? And then pull it back out. You could also bleed the point using one of the lancets that we talked about in class, or you could use one of these McKesson safety lancets where you unscrew this rod here, pull that out, the needle is in there, and you just basically depress this plunger over, and I would mark the spot so it gives you kind of like a place to aim at. And a 2 millimeter needle comes moving out extremely quickly. So all the patient feels is like this little tap. However, these needles are quite sharp, and it's a 17 gauge, or you can get 18 gauge. So it might stimulate a little bit more blood than you're probably used to. So just be mindful of that. You don't need to take out more than like 10, 12 drops. So just be mindful to have like a tissue, wear a glove, have a tissue or something like that. I wouldn't use a cotton ball because the fibers of the cotton ball kind of stick to the wound. So when you pull the cotton ball off, you're kind of reopening it, and it bleeds more. And in addition, you've got all these like weird little cotton ball fibers stuck to it. So it gets quite messy. So I wouldn't really do it that way. So gathering point, jing well, either bleed it or strongly tonify it. You can either use traditionally what's called a hot needle. So you could take your needle and then you could take a little match or a lighter and just heat the tip and then quickly needle it. The patients actually don't feel any heat, interestingly enough. So I guess it's just not the nerves there to sense that temperature difference. So that's the easiest way to do it, right? And then you have the patient move around again to see if there was any improvement. Now, if you really want to kind of go down the rabbit hole and treat it a little bit more not aggressively, but more comprehensively, you can leave those needles in for just a few minutes and then go back and palpate, go back to those ashi points that you palpated along the channel, and then you would needle those. They talk about the chisel technique where you have your arm and your elbow and your wrist completely straight. And the method of needling is like this, right? Where you're like chiseling at the point. Honestly, that's fine. It's a little bit complicated and takes some practice, but the simple lift and thrust with the emphasis on the lift is absolutely sufficient. So I'll just, I'll get it to depth, right? About the muscle depth and lift, right? And then down back to depth and then lift, right? And then down back to the depth and lift and then remove, right? And you can kind of traverse along the trajectory. And I would recommend going from proximal to distal, going like away from the center of the body towards the Jingwell point, because that's the way, that's the direction we're trying to move the pathogenic factor out. So that just makes sense. Okay. So in that regard, you would do the gathering point, the Jingwell point, leave them in for a few moments. Although I usually take the Jingwell out. So you would do the gathering point, treat the Jingwell, go back, treat the ashi, just lift and thrust or the chisel technique, don't retain the needle, then go to the next one, then the next one, then the next one, moving from proximal to distal, okay? There's in the Taoist tradition, at least what was, transmitted by Jeffrey Yuen, he talked about treating the sinew that's the most interior first, and then the most exterior last. And the order goes from pericardium to liver, to heart, to kidney, to lung, to spleen, to large intestine, to triple heater, to small intestine, to stomach, to gallbladder and bladder, right? So that's pericardium, liver, heart, kidney, lung, spleen, large intestine, triple heater, small intestine, stomach, gallbladder, bladder. I don't think it makes really all that big of a difference. I've tried it both ways, and frankly, every single way I've treated the Sinew meridians has been great, has been very successful. The only time it's not as successful at other times is when there's these underlying deficiencies that I mentioned before about kidney yang, stomach fluids, lung qi, and a lot of stagnant liver qi. But other than that, I don't know, it's like making tomato soup. I mean, how hard is it to screw up tomato soup, right? So as long don't get so bent around the axle around it. It's simple. Just start with the simple treatments first, right? Gathering point, Jingwell. If they get like moderate benefit, you're off to a good start. Then do the next time, maybe do more involved, or go back in that moment. You can actually repeat the treatment in that moment. Go back, do the gathering point, then do the Jingwell point, right? Take it out or bleed it, and then go back and do the Ashir points. Perfectly acceptable, okay? What else? You can also go back and moxa the Ashir points that were tender after these other needles are out. And then you can also do cupping or moving cupping on areas that you suspect a lot of cold and occluded blood, provided the local area will allow you to, to use cupping. What you're going to be basically doing is traditionally you would treat these, I think it was up to 3 times a day, 3 days in a row, and then you would take a day off, and then, or maybe a couple days off, and then reevaluate it. And then you want to, but you don't have to do it that way. I mean, nowadays, most people can only come in like once, maybe twice a week, if you're lucky, if their schedule is very flexible. And that's totally fine. What I would say in that regard, if that's the case, if they can't come in like a couple times or 3 times a week, then what I do is I have them make sure that they rest the area, which people never do. So then I make sure that it's warm and covered, right? Especially in the cooler months, because again, we don't want wind driving in any more cold. I would have them really seriously avoid, I really emphasize having them avoid any kind of raw foods, cold foods, or sour foods, right? Because these contract and astringe respectively. And then avoid any ice or cold packs, even if they're, PT or chiropractors demanding they use ice, no ice, okay? And I have them take Epsom salt baths or sea salt baths, and I'll usually send them home with a liniment. I have a number of liniments that have warming herbs, balanced with a few like blood moving herbs, wind dispelling herbs, and pain alleviating herbs, okay? And we can talk a little bit more about that later. You can also, I will post a little bit on essential oils that you can have them take home and dilute a little bit, and a little bit goes a very, very, very long way. And this will help stimulate that Wei Qi to protect it from further invasion, as well as enhance the Qi and blood circulation and flow, and through the muscles and through the fascia. Okay, and so there you have it. So if you have any questions, please don't hesitate to let me know.